Welcome to the Reardon Clinic, and thanks for coming. We're going to talk about enhancing your health through IV nutrition. We're not going to talk about the macronutrients today, so we're not going to talk about carbohydrates and proteins and fats that you always hear so much about. What we're going to spend our time talking about is the micronutrients, so the vitamins and minerals mainly, and how to get them and when to get them and why to get them through intravenous therapy or IV therapy. Okay, so on the agenda for today is the definition of vitamins and minerals, what they are, basically more about intravenous nutritional therapy, but we will talk about the benefits of IV therapy over oral supplementation and food. So we're going to talk about digestion and absorption of nutrients. And then we're going to talk about the most common nutrient deficiencies in America and how the ones that you can get via IV. We're going to talk about what causes these deficiencies, the symptoms of deficiencies, and how to get them through food and supplements as well as IV therapy. So let me get you guys kind of involved. When I say the word vitamin, what's the first thing that comes to your mind? Anybody? First thing that comes to your mind. What's that? Pills. And that's normally what people say, pills. But vitamins and minerals are not pills. They're actually, let's go to the next slide. They are actually components of your food. Everything that you eat that comes from this earth, not all the processed stuff, but everything you eat has vitamins and minerals. And the difference between vitamins and minerals basically is vitamins are considered organic, which means they have carbon, hydrogen, and oxygen. This is actually, where's my laser? This is actually vitamin A right here. Minerals do not contain carbon, hydrogen, and oxygen. They're bigger. And those examples are calcium, magnesium, zinc, iodine, potassium. Those are considered minerals, okay? They are actually compounds in this earth, our soil. The thing about vitamins and minerals is that they're absolutely necessary for your metabolism to work, okay? Your body cannot function without them. So carbs, protein, and fat, that's great and all. It's good to get them in, but if you're getting all of those things but you're not getting the vitamins and minerals, your metabolism is not going to function. Who knows what metabolism is? Anybody want to answer that? Your energy. Anything else? Anybody else have another definition for metabolism? Okay. Anybody? Okay. This is your oh gosh, you can't really see it on the PowerPoint, but this is your metabolism. This is not a good picture. It doesn't show up. You can see it better on the TV screens. Don't worry, I'm not going to explain this to you guys, okay? So what this is every metabolic process, well, most metabolic processes, the major ones, it's not all of them, that is going on in one cell of your body, okay? So you learned in high school biology, your body's made up of organs, your organs are made up of tissues, and your tissues are made up of cells, and you got billions of them. This is going on in each cell of your body, okay? So everything you eat is what's fueling this. And if you have any deficiencies or excesses or toxicities, it's not going to function. And if it doesn't function, what happens? Yeah, well, eventually you die, that's correct. But you start having symptoms. You start having dry skin, your hair falls out, vision problems, you name it. You start having headaches, blood pressure goes up. You start having symptoms. So you always hear about increasing your metabolism, right? Because everyone wants to lose weight and increase their metabolism, and you hear about all these herbs and all this, and fish oil can help increase your metabolism, and that's true because so many people are deficient. If you're deficient in something, this is not going to function, and if you get it back up to the efficient level, this will start functioning, your metabolism will work, your symptoms will go away, and you'll probably lose a little bit of weight because your metabolism has increased a bit, okay, if your nutrition is where it needs to be. So that's metabolism, okay? I just kind of want you to understand how complicated it is. All right, so IV nutrition, it's not where we put fruits and vegetables in an IV bag, but it's basically giving you the nutrients straight into your bloodstream, okay? You don't have to go through digestion and absorption. Vitamins, you can do carbohydrates and proteins through IV, but basically vitamins, minerals, and amino acids are what we're going to talk about today. All right, so the benefits of IV therapy over oral therapy, because naturally you should get it from your food, but with our modern life and the way we've evolved over the last 100 years, we're not getting everything in efficiently, and IV therapy in a lot of cases is the best way to get things in. So you have maximum absorption, okay? When you take things in orally or through food, you might not absorb it all. And I'm going to show you real briefly in just a second about digestion and absorption. And also, certain nutrients you cannot take in orally, like glutathione. If you take it in orally, your body digests it. The best way to get it in for treatment is via IV, okay? So real quick, because I think everyone needs to know what happens to your food when you eat it. Do you all know what happens to your food when you eat it, after you eat it? Does everyone know? Yeah, right. So I love asking this question because most people don't know. So I think you really need to know, and I think it's cool, so I'm going to tell you. All right, so this is digestion, okay? When you eat food or a supplement, if you're trying to get your nutrients up, it goes down your esophagus, right, that tube, into your stomach, and then you have hormones that are secreted that make your body secrete acid, and so your acid's binding up with your food, digesting, and then it goes down a little further into your small intestine. Then you have all these other wonderful hormones that come out that stimulate your pancreas to secrete digestive enzymes. And your gallbladder here will start dumping out bile when your food, and bile is to help digest fat. Now, if you don't have a gallbladder, which so many people don't, you know, your liver makes the bile and it'll just be dumping it randomly and not when you eat, and then you can have problems too with digestion, but we'll talk about that in a minute. And then after it goes through the small intestines, that is when absorption happens. Okay, this is digestion. Now we'll talk really briefly about absorption. And absorption is basically getting the nutrients into your bloodstream, okay? Because that's how your cells get the nutrients, is through your blood. And this is how it gets into your blood if it's not via IV. Okay? So absorption. Now this is kind of complicated, but can you guys see this? Okay? Okay. This is actually the tube of your small intestines. Okay? This is where the food goes. And if you look, this is on the lining of your small intestine. You have these little fingers called villi. Okay? And this is just a blown up villi. This is one of these little things. You see this? This is blown up. And inside those villi, you have blood vessels or capillaries, okay? And on the tip of these villi, look even smaller, you have microvilli, so very, very small villi right here. And you have these little bitty fingers right here, okay? That's to increase surface area for absorption of nutrients. But you have these little fingers here, that's where all the absorption takes place, and it goes into this cell. And there's a lot of things that happen in this cell. We're not going to talk about that today. But a lot of things happen. And if there's damage in these cells or inflammation in these cells, you can have a whole lot of problems, vitamin deficiencies, food intolerances, all kinds of things. Okay, for instance, vitamin A, most vitamin A is made right here from beta carotene. You know, if this is inflamed, you're not going to make vitamin A if you're having GI problems. So, and then that goes into your veins, or your portal vein to your liver, and then liver detoxes and does its job, okay? So that's absorption, complicated, okay? So we'll talk about problems where this can cause nutrient deficiencies if you're not absorbing properly, and where IV therapy can be very beneficial. Okay, so the most common IV cocktail that is used, and the one that we use here very regularly, is called the Myers cocktail. It was formulated a little over 30 years ago by Dr. John Meyer and Alan Gabby, I believe, helped do that. And it's a basic nutrient formula. This is everything that's in the typical Myers: B complex, vitamin C, magnesium, B5, calcium, B12, and B6. And sometimes we don't put B12 all in our mini Myers, but it is in the typical Myers cocktail. And this was formulated mainly for chronic fatigue, chronic pain, asthma patients. And from my understanding, you can tell me if I'm wrong, Dr. Ron, but when they were treating patients for this, not only did they get better with their fatigue and their pain, their other symptoms started getting better, like chronic migraines, their acne cleared up, and so they started utilizing these IV therapies for other disorders as well. Basically, these people were deficient in nutrients, and this was helping get their levels back up through IV therapy. But this is yes.
Doesn't have vitamin A in it?
No. None of the fat solubles can be done via IV. okay, because it has to be a water-soluble vitamin.
How do you get vitamin A then? Just a regular vitamin?
You'd have to take it orally. They don't do vitamin A. I know you can do a vitamin D injection, that's once a year, but not vitamin A. It has to be done orally to get that in. Okay, and it has to be taken with fat. Did you come to one of my other lectures? We talked about, I don't know if you were there, but we talked about vitamin A has to be taken with fat too as well to help with absorption. But no, vitamin A is not going to be in an IV. Okay, so we also do some spin-offs of the Myers to treat different disorders, and all it is different levels of certain nutrients. We can use other amino acids, but IV therapy can help a whole lot of people with all different kinds of disorders: migraine headaches, high blood pressure, PMS, shingles, any kind of acute viral infection, urinary tract infections, pre and post surgery. It's really good to get IV therapy. Yes.
Macular degeneration. Do you have a special formula for that?
For what? For just generating what's your question again? I'm sorry.
For macular degeneration, you have a special formula for that?
Yes, we do. Yep.
What does it do for it?
Basically giving the nutrients back into the macula that the macula needs to heal. Yep. It's a certain I don't have the exact formula in front of me to look at the right amounts, but there is a certain formula and different amino acids you can use for macular degeneration. I haven't used IV therapy much for macular degeneration, so I can't comment on that. Okay. But yeah. Okay. So those are the specialty formulas. So how are IVs given? They're usually in a 200 milliliter bag, and we're going to actually demonstrate in just a moment. They're infused slowly over the course of anywhere from 15 minutes to up to 2 hours, depending on, maybe even longer, depending on the patient and what's in there. Some can be infused more quickly, and others can take hours, just what I said. So we're going to have Nurse Cameron over here. Go ahead and demonstrate an IV for you on Lacey. So if you guys want to come on up and do your thing. Have all of you had IVs before? Most of you have? Okay. Well, believe it or not, some people and some patients we see have never had an IV, never seen an IV. So it's good for anyone who's watching too. Can watch this. Okay.
Hi, I'm Cameron, and I'm going to demonstrate an IV. This is a mini Myers, which has 5 grams of vitamin C in it. All of the IVs given at the Rudin Clinic are administered by registered nurses. And it's not uncommon for us to have people come for their IV feeling a little anxious because we do use a small needle.
So basically with the IV, all it is not very painful. It's just kind of like a little pinch or a mosquito bite when the needle goes in. And for the most part, most people don't feel anything. Some people kind of feel coldness or warmness or may have a flush. But the majority of people will not have any kind of feeling once the needle is in and the IV fluids are going. Okay? So Cameron's going to sit here and administer it, and I'm just going to narrate what she's doing. So it's a very small needle that she's going to right into the vein, right into what they call the antecubital area on the other side of your elbow, the inside of your elbow. And she's just pumping up the blood pressure, cuff. Then she's just going to alcohol it, stick the needle in, tape it down, and turn the IV on, and she's just going to sit here and relax and watch the rest of the show. Just for an IV? Well, it depends on where. Usually anywhere from $80 on up per IV, depending on what's in it, how much vitamin C. All right, so the duration of treatment. I knew you were going to ask that. So for acute conditions, or acute meaning colds, viruses, urinary tract infections, spider bites, things like that, IVs can help. You really want to come in as soon as you feel the symptom, okay? Sometimes all you need is one IV. We might order 3 days in a row for someone with an acute type infection. Chronic conditions like cancer, autoimmunity, fibromyalgia, usually once or twice a week in the beginning, sometimes 3, depending on what we're doing, if it's someone with cancer or not. And then we can kind of tether down from there. But that's on average. And sometimes I have women come in monthly that have endometriosis or any kind of heavy menstrual cramping, problems with that, they can come in at a certain time of the month and get an IV with certain levels of other nutrients to help with that. So it kind of varies. All right, and we really individualize the IVs per patient too, so we can change things around as needed. Okay, did that answer your question? Yes, okay. All right, just another quickie. I just wanted to put a little blurb about intramuscular injections or IMs. That's another way you can get nutrients in. Certain B vitamins and magnesium can be done this way. Not everything, because it can irritate your tissue, so sometimes it's best to do it IV, but that's another way that people can come in, and that's really quick and easy and pretty painless for the most part to get an IM injection. Okay, so now what I want to do is, everyone always asks, why do I need IVs? Or I eat great, I'm not stressed, no one's stressed. Why do I need IV therapy? So I want to spend some time talking about the most common nutrient deficiencies. I'm really going to spend most of my time on magnesium because I'm going to kind of do a little visual over here to kind of, I don't know if you'll be able to see it very well, but I'm going to talk about the different causes of each deficiency, the symptoms that they can cause, how we treat them conventionally, and how that causes more symptoms, and then it becomes this big kind of web of problems. So I'm going to spend some time talking about magnesium deficiency, and then we'll talk about some of the other ones if I have time, and then I might have Dr. Ron say a few things if he wants to. Okay. All right. So magnesium deficiency. All right. Does anyone knows what can cause a magnesium deficiency in America? Good answer. Stress. That was the first one I wanted to talk about. So stress can cause a magnesium deficiency. So we're talking low-grade chronic stress. Basically modern life is pretty stressful, no matter if you think so or not. But emotional stress, physical stress, mental stress, work, kids, finances, traffic, overstimulation is stress, so constant noise, TV, all of that's pretty stressful to you. So low-grade stress. And people who have chronic stress all the time, how do they normally cope with it sometimes? What are the first things Americans grab? You see it at every corner. Sugar. That's one, but coffee, alcohol, those are what? Diuretics. Okay, so a lot of times we start using diuretics. Okay, they get rid of water. Okay, I'm sorry, you probably can't read this, but diuretics. So this is coffee, alcohol, and then you have prescription diuretics, of course. Okay, so prescriptions. Okay, prescriptions. So this really depletes magnesium. So if you're on any of these, if you utilize any of these coping mechanisms, which probably we all do to some extent, you will have magnesium deficiencies, okay? If you're sweating a lot, if you're an athlete and you do a lot of sweating, like I sweat a whole lot, I can't keep my magnesium levels high enough because you will lose magnesium through sweat, as well as potassium and other things. But magnesium is one Americans aren't really getting in their diet, and I'll talk about that in a minute. But what's another thing? Oh, you said it already. You said it. That other thing that causes sugar. Dr. Ron said it, sugar. So our diets cause magnesium deficiency. So this is basically the SAD diet, which is the standard American diet. We call it the SAD diet. And sugar, so that's cookies, crackers, cakes, all processed food, Pop-Tarts, Pizza Bites, Goldfish.
Pop-Tarts? Yeah,
Pop-Tarts. Toaster strudels, your Eggo waffle in the morning, your ice cream at night, all of those things, candy bars, Snickers, are the American diet. Our brains are so warped to what's healthy. My daughter, they said to bring healthy snacks to school, and on the list was Goldfish. And in my mind, that's not a healthy snack. It's just kind of, I don't know why they think it's healthy, but yeah. It's just junk, basically. But anyhow, our diet, so high sugar and especially refined carbohydrates, okay? Carbs. white flour, white carbs, okay? So our diets are causing magnesium deficiency as well. So if you address all these things, then you won't have a magnesium deficiency, or if you make sure you take more, or IV therapy can help prevent that if you're going through a lot of these. But over time, this really depletes magnesium deficiencies, and then you start having symptoms. What is one symptom of magnesium deficiency? Does anyone know? I know you know, Dr. Ron.
Hair falling out?
Probably, but what's one of the major ones? We'll talk about that. Problem sleeping, yes, that's one.
Muscle pain?
Muscle pain. Okay, so let's talk about muscle spasms. Okay? Muscle spasms. And then what happens when your muscles spasm a lot? They squeeze on all your joints and all your bones, and then you start having chronic pain, back pain, neck pain, all of these problems. Okay, so those are spasms. And then you have a lot of pain. And then what do you take for pain? But what is the main drug of choice for pain? The first thing you grab? Advil. So that's an NSAID, Advil, ibuprofen, so non-steroidal anti-inflammatory. So let's just use the word Aleve because everyone knows what that is. Okay, so did you guys know that Aleve depletes nutrients, right? Folic acid, iron, and vitamin C, or 3 of the nutrients Aleve will deplete. Okay? So if you're on Aleve long term, you're going to have problems with all of these. Iron and vitamin C. Okay, so that's where you could get your vitamin C deficiency. If you had levels down here and it was low, that might be why if you're on Aleve all the time. All right, so let's talk about another symptom. I'll go ahead and start. Depression, okay? Which is kind of an epidemic in this country. Depression. So you start feeling sad and apathetic, and then you're depressed, so what do you start doing? You start drinking coffee and alcohol, and then you start eating your sugar and your chocolate at night because you're so depressed, and then it becomes this whole web of problems. So you're depressed. And then what's the first drug of choice? You go to your doctor, your first drug of choice is what? Prozac. You read my mind. So SSRIs, selective serotonin reuptake inhibitors. So what those do is it increases the life of serotonin in your cell. So serotonin is kind of one of the happy hormones. Did you know that magnesium is needed to make serotonin? And we'll talk about that in just a minute. I'll show you a little thing. But magnesium is actually needed to make serotonin. And guess what? SSRIs deplete nutrients too. Okay? Mainly folic acid, B12, and B5. Okay? So now, you have a folic acid deficiency and all these other vitamin deficiencies, and then you just get more depressed. And then it just becomes this little cycle of problems when all you really need to focus on is what? Stress, decreasing that, and changing your diets. Okay? Now, this is why lifestyle changes are extremely important. Okay, so let's keep going. So magnesium deficiency also causes vasoconstriction. Okay, which is muscle also another So it's vasoconstriction. So what is that? Right. So your arteries and veins are tightening, constricting, and that'll cause high blood pressure. Okay? And guess what else? That's why stress causes high blood pressure. Okay? You're stressed. This is one of the reasons why it causes high blood pressure. So if you have high blood pressure, what's the first drug you're put on? First drug of choice. Diuretics. So then,
What was it?
diuretics, like Lasix, hydrochlorothiazide diuretics, those kinds of things. So then you're put on diuretics, and then you're just depleting more magnesium, more problems, okay? All right, so another symptom of magnesium deficiency is loss of bone, okay? Bone loss, because magnesium is needed to make bone. And then, if you're a woman, a lot of times you're put on what for bone loss? Yes.
Calcium?
Yes, but also hormone replacement therapy, estrogen therapy, and then those start depleting folic acid, B12 and B5, and a whole lot of other vitamins, and then the web just keeps going on, okay? So I hope y'all are kind of getting the picture here. All right, so then another thing magnesium deficiency causes is, do you know, Dr. Ron? Okay, high blood viscosity. So what is that? Thick blood, okay?
And that's caused from what?
Can be caused from magnesium deficiency.
Ah,
So what drugs do you put on when you have thick blood because you're clotting a lot? Yes. So warfarin, Coumadin, Plavix,
aspirin?
yeah, aspirin, which would also be another. It's a little different than Aleve, but it will deplete a lot of vitamins too, and vitamin C. Aspirin will deplete. So if you're on aspirin, you're not told to, it's probably not the best thing to do. Okay, so Plavix, warfarin, and everyone knows that warfarin is what? Rat poisoning, right? Because it causes the rats to bleed out, but in a little bit amount it helps with clotting. So, but what it's doing is it's preventing vitamin K. It's decreasing vitamin K. So then you don't have any vitamin K, and what else is vitamin K important for? Because that's one of the biggies now, right? Bone health. So then you start having more bone loss, right? So then you go over here, start having bone loss. Okay, so when all we had to do was address stress, diuretics, and diet, okay? It sounds very simple, but it can be a very complicated, really the magnesium deficiency is causing a lot of this, but this is the main underlying causes. And that's why all of that has to be addressed if you really want to get better, because eventually over time, maybe not the next day or even the next year, other chronic problems start happening, other deficiencies. This is your whole body, all of these work together. Okay, so this is not, there's other things happening, but I just kind of wanted you to kind of get a point here that nutrient deficiencies can be caused, and any person can have a magnesium deficiency, and this is kind of what happens and how chronic disease can start formulating in people. So, any questions? Is this helpful at all? Yes?
Yes, it is. But you talk about high blood pressure. What if they have low blood pressure?
Well,
Same thing?
kind of. I mean, it's very complicated. Low blood pressure is usually caused by adrenal fatigue, which is there's a whole other process of that too. But you can still have magnesium deficiency and have low blood pressure, definitely. Any other questions?
Well, so are you saying that you really need to do this intravenously rather than taking, like I take magnesium and calcium,
Mm-hmm. Right.
and I have muscle spasms
Mm-hmm.
on my back.
Well, sometimes people aren't absorbing enough. And with magnesium is a big one because, you can only take so much orally. Because if you take too much orally, you get this osmotic difference in your colon, and it causes loose stools, diarrhea, basically. Okay? So sometimes you can't get enough in orally to help someone who's very deficient or is constantly losing it all the time because they're on diuretics or they're sweating a lot, or because of stress and diet and all of those things. But there are some instances, and we're going to talk about that in just a minute. That's a good question. Why absorption through supplement and food might not be the best way, okay? So we'll talk about that in a minute. But IV therapy can definitely help. It can be more efficient, more effective, and quicker at helping a lot of these symptoms with modern life, okay? Because our lifestyles have evolved, done a complete 180 in the last 100 and 150 years. And our bodies just haven't evolved quite so fast to handle a lot of our stresses that we put on our bodies every day. So that's why IV therapy. 200 years ago, taking it in was probably okay enough, but not today because of all the different stresses, toxicities, things like that were constantly, yeah. Okay, does that make sense? Okay, so that's a little bit about magnesium deficiency. Some of the other common nutrient deficiencies in America that can be given IV is vitamin C, zinc, and B vitamins. How much? We have a half hour. Okay, so we have some time. So what I'm going to do, let me show you this. These are slides that I had first done, and then I decided to do this little visual for you guys. So let's see if there's anything else I wanted to show you. Basically, it's saying the same thing I just talked about. I wanted to show you this here, serotonin production. I'm not sure why this isn't coming out very good on here, but serotonin right here, right? That's the feel-good hormone, and then melatonin is the help you sleep hormone, right? So I just wanted to show tryptophan's from protein. turkey. You always hear about falling asleep with turkey, right, and Thanksgiving. So that's where you get a lot of tryptophan from. But I just wanted to show you that zinc, B6, and magnesium are a part of this whole process, okay? So if you want to make if you have a deficiency in any of those, you're going to have a problem making serotonin and melatonin as well, okay? But it's a combination. It's not just magnesium, okay? And then dopamine too. See, I couldn't put the picture without putting dopamine over here. But dopamine is also another feel-good hormone too. So if you're magnesium deficiency, you might be quite depressed. Okay. All right. So these you can read on your own. This is good information. I talked most about those. These are just disorders that magnesium deficiency is related to: anxiety and panic attacks, asthma, constipation, hypertension, which is high blood pressure, insomnia. Okay, here. Oh, well, it's not up there anymore, but making melatonin, nerve problems, nerve twitches, muscle twitching, osteoporosis, diabetes, and heart disease, okay? Magnesium deficiency is related to all of those. All right, so testing your magnesium levels, the best test is going to be a red blood cell test, not a serum magnesium. Red blood cell is the best indicator because it is telling you what's getting into the cell. It's a better test level of your magnesium. Serum magnesium is not necessarily the best test for that. Okay, so the best sources of foods: seafood, nuts, leafy greens, and fruit. Okay, again, this has to be gotten in daily. So if you're not eating these foods daily, which unfortunately most Americans aren't, I see a lot of diets and most people are not eating any of these foods, basically. So if you're not, best supplementation, each nutrient, by the way, if we don't get to them all, I write down in there the best supplement form of that nutrient, because when you're looking on supplements, there's all different forms. You want to make sure you have the best form, just so you know what that is. So the best form of magnesium is chelated forms. So magnesium citrate is one that we utilize a lot, aspartate, orotate. The worst one is magnesium oxide. If you have a 1 a day from Walmart, probably has magnesium oxide in it, not a very good absorbable form. And also magnesium hydroxide is a laxative form, so that's like Epsom salts. Okay, so you don't want that one because you're not going to absorb it. Excuse me? Why you don't want it? Because it's a laxative. So it just causes you to flush.
Why don't you want it?
Because, well, if you're constipated, it might be a good thing.
It cleans you out.
Yeah. It also helps if you this is an aside, but it can help draw out infections and toxins if you soak like a infection in magnesium hydroxide, like Epsom salts, things like that, if you're soaking Epsom salts. So anyway, that's an aside. But all right, vitamin C. Everyone knows about vitamin C, right? We're famous for our IV vitamin C. All right, we're basically, well, us and guinea pigs, apes, and a fruit-eating bat. Apes, right? Apes don't make vitamin C. Primates. Okay. Monkeys make vitamin C, though. They're not. No. And a fruit-eating bat are the only animals that do not make their own vitamin C. Okay, I guess apparently we used to, or we have an enzyme that shows that we used to make vitamin C, but we evolved away from it for whatever reason. I don't know, maybe Dr. Ron does. But we don't make it. We have to get it every day, okay? It's not stored in the body. It's a part of all over the body: wound healing, immune function, teeth, bones. Bleeding gums is one of the first but not all the time. You might have low levels of vitamin C and not have bleeding gums. It basically keeps all your cells glued together, okay, which is probably a good thing. So you don't want to become deficient. And so there are times when you have increased needs, and these are some of the times: pregnancy, lactation, inflammation and infections, diarrhea. If you take too much magnesium hydroxide, you might need more vitamin C. Toxic exposures. So if you're a woodworker and you're constantly exposed to formaldehyde and all the fungicides on wood, you're probably going to need more vitamin C. All right? It's not stored in the body, so you need it daily. Daily. Okay, so, all right, this is just a picture of which you can't see very well, but this is scurvy, this picture of scurvy, which is pinpoint bleeding under the skin, so it looks like little pinpoints of bleeding, because vitamin C is a part of wound healing and vessel health. Vitamin C helps keep your vessels healthy. So if you have nicks and tears in your blood vessels because you have high blood pressure, and you don't have enough vitamin C, your body's going to have a hard time fixing those blood vessels. Okay, so fatigue, depression, anemia. Vitamin C deficiency can cause high cholesterol, dry skin and hair, can cause weight gain, okay? Because again, if you don't have enough of a nutrient, your metabolism slows and you can start gaining weight. And it can lead to a cancer type picture, lack of antioxidants activity in the body, all right? So deficiency of vitamin C can actually occur pretty quickly. If you go like a couple months and I had a patient one time who was in school living off candy bars and soda and became pretty deficient in vitamin C rather fast, okay, within a couple months. Don't ask me why she was living off candy bars and soda, but that's what it was. All right, so measuring your vitamin C levels, plasma and urine levels are ways we test it here. So even if your plasma level is within normal, if your urine is 0, that's telling us your body isn't quite saturated with vitamin C and you probably need more because your levels are going to change at certain times depending on toxicity, stress, things like that. Do you have any other points to put about vitamin C, measuring it? I mean, did I do a good job saying it, Dr. Ron? Okay. So you kind of want to, it's good to do the plasma and the urine at the same time. And you can test your urine pretty regularly to see if you're getting enough. Supplement, like if you have an infection or stuff, if you test your urine and if it's not high, then you probably need to increase your oral dose. That's a good way to kind of test at home, and it's kind of fun.
That's just a kit you buy?
Yeah, we have little strips upstairs you can get and test your urine to do that, okay? So sources of vitamin C, everyone knows oranges, right? Citrus fruits. Actually, the number one vegetable the highest vitamin C content is found in bell peppers. Okay, green bell peppers, red bell peppers, so eat your bell peppers. All right, raw is the best, okay, for vitamin C anyways. You can also, there's supplements, there's powdered and capsules and tablets and buffered and pure acid and all different forms of vitamin C supplementation. Okay, vitamin C is also one that we do a lot of IV therapy for cancer treatment and adjunctive care with people with cancer. If you take too much at one time, it will cause loose stools. So sometimes you can't get enough in your body. That's why IV therapy is very helpful. And with certain disorders, you want to get a plasma level extremely high, which you would never, ever reach with oral therapy. That's why we do IV therapy in certain disorders, okay, to get that plasma level up very high. That blood level, it's plasma, okay? And I think I just talked about this. IV vitamin C is the best way to saturate your tissues quickly and get that plasma level up at the level where it's actually a pro-oxidant, which is going to help treat things like cancer, help kill off cancer cells and stuff like that, okay? All right, so how much time do we have? You want to talk? Yeah, say a couple things. That'd be great. Everyone, you know Dr. Ron.
Yeah, Dr. Kallmeyer asked me just to say a few things about vitamin C, just to let you know about how important it can be. Since I've been here in the last 23 years, I've probably overseen 60,000 IV vitamin Cs. So we do a lot of intravenous therapy. And the reason we do is because people tend to wait until they get really sick before they come to see the doctor. If everyone was really thinking lifestyle and thinking ahead, we probably wouldn't even have to do IV nutrient therapy. So nutrient therapy given IV is kind of an emergency situation. Your body is really low, you're running really severe symptoms, you need to get the nutrients in, and if you try to give too much vitamin C orally, it'll cause diarrhea and upset stomach. But we can give tremendous amounts of vitamin C IV very comfortably. And I'm going over to the Netherlands in about a month to talk about this, and one of the things that I thought about in making my presentation is that IV vitamin C is kind of the quantum mechanics of nutrition. And I don't know, physics, at one point they thought everything was known that needed to be known about physics. And there's a lot of people who think that everything we need to know is known about nutrition. But when you start doing things intravenously, you achieve all kinds of special effects like that pro-oxidant effect. Didn't most of you know that vitamin C is an antioxidant? And that's what most doctors, most oncologists still think, and it is an antioxidant. But when you give it intravenously, it becomes a very powerful pro-oxidant. So it can kill viruses, it can help kill cancer cells, it can help your body heal from cancer. It can, Dr. Reardon developed a really severe spider bite, and that's an emergency. And you can't take enough oral vitamin C to deal with that. But IV vitamin C can help reverse the toxicity of the spider bite. So what we find with intravenous nutrition is that people who are chronically ill, for whom oral nutrition isn't quite fast enough to get them feeling better so that they can get back to work or get back into their lives, IV Myers, IV vitamin C, IV B vitamins, and things like this, magnesium, can help them get back on their feet quicker. So in many ways, it's for those people who have waited too long and are too sick to do oral therapy. But oral therapy is still the foundation. It doesn't mean to say that you should just forget taking your oral nutrients and eating good, because that is still the foundation. But this is a type of nutritional medicine therapeutic tool that we have available that can help people make quick progress so that they get some encouragement. Because a lot of the people that we see here have lost hope, they're frustrated, no one can figure out what's going on with them. And Dr. Myers was dealing predominantly with chronically ill patients. And so he found that when he gave them the Myers cocktail twice a week on a regular basis, people who they had no other hope, they began to get better. And so you're overcoming the digestive problems, you're overcoming the severe nutritional deficiencies, you're giving multiple nutrients simultaneously. And so this web of interactions that Dr. Kallmeyer is talking about, it's very disheartening for a lot of people. They can't break out of it. And when they get an IV on a regular basis, now one IV may not be enough, but if you get a series, pretty soon those illnesses that just wouldn't give way for anything start to get better. And so that's part of why we deal with cancer patients using IV vitamin C. For a lot of people, they come to us in a very hopeless state. Everyone's told them there's nothing else we can do. And IV vitamin C, sometimes it's the cure, sometimes it's not, but always it's improved quality of life with IV vitamin C. So anyway, just a few comments. So I hope that helps. So thanks.
No, that's very helpful. Thank you, Dr. Love.
Is my thing still? Yeah, it's still on. All right, that was great. All right, so the other deficiencies, we don't have too much time, and I want to touch on the end of the PowerPoint, so I'm going to briefly go through these, but they're in your, I wanted to put them in the PowerPoint so you had them, so you can go home and look at your supplements and see, am I taking something that I'm absorbing, or am I wasting my money and time taking these supplements orally? So, and all of these are things that we give IV as well. All right, so zinc is very important. It's important for especially epithelial tissue. You remember when I showed you that diagram earlier with the GI tract and absorption? Those are epithelial cells. They replicate very quickly and a lot, and zinc's a part of that. So especially with hair, skin, GI health, prostate for men, okay? A big problem with infertility is zinc deficiency, especially in men, okay? So sense of taste and smell, one of the first signs of zinc deficiency is loss of smell, okay? So if you're having any of those problems, you could be deficient in zinc. So these are, I just talked about these are some of the signs of deficiency. One thing that you can actually do on yourself is look at your fingernails, and if you have these white, you see better on the TV, these white spots, that is a sign of zinc deficiency. You can also get it if you hurt your fingernail, but if you have multiple all over your fingers like that, that is a sign of zinc deficiency, and you need to get more zinc in, okay? Yes. All right, and then also body odor. If you have a lot of bad body odor, that's a sign of zinc deficiency. Acne, a lot of vitamins can cause, the deficiencies of vitamins can cause acne, but let's go on. So you can measure your zinc levels. We do that here. Serum levels and red blood cell zinc levels, that's the best way. We also have hair analysis. There's something called the zinc tally test where not many people use that, but that's when you drink the solution, and depending on how your taste buds react tells you if you're zinc deficient or not. And it's estimated that 90% of the population has a mild zinc deficiency. And the reason that is because just like magnesium, our soil is very depleted of zinc, okay? The way we're growing things and our zinc levels in our soils are very, very deficient. So these are the different foods, seafoods, legumes, nuts, so split peas, lima beans, yummy, nuts, wheat, germ, and vegetables, whole grains. The best way is through nuts and seeds and seafood and vegetables are not the best because the soil is greatly declined, and whole grains is not the best source of zinc because the fiber will bind the zinc. And so if you're not eating nuts and seafood and legumes, then you're probably zinc deficient, or if you have one of the disorders that I'm about to talk about in a minute. But zinc supplementation, this is, you can bring this home and look at this. I have for each one, again, the best forms, the bad forms, the best ones, the good forms, bad ones, and other forms. If you go home and you see zinc oxide in your supplement, which is normally in the 1-a-days, not good, don't take it. That's actually what's used topically, okay? That's what's in sunscreen and diaper rash cream, okay? So a lot of the form is very cheap. It's very, very cheap. That's why it's in there, okay? So that's what the thing says at the bottom. Okay, so that's all about zinc. Any questions about zinc? Okay, so B vitamins, I'm just going to rush through these so we don't have much time. B1 is thiamine, B2 is riboflavin, B3 is niacin, B5 is pantothenic acid, B6 is pyridoxine, and B12 is B12 is cobalamin, and then there's folic acid as another B vitamin. So B vitamins they all work together. I was trying to kind of talk about them together. They're part of energy production in the cell. So remember that big cell I showed you with all the so the B vitamins are part of making the energy for everything in that cell to function. Okay, so every cell does a whole lot of jobs. The B vitamins are part of the energy production of the cell, making DNA, all of those things, replicating cells. And so if you're deficient, you can have an array of symptoms all over your body, okay? These are the food sources of B vitamins. They're found in fruits and vegetables, grains, dairy products, okay? In each one, I'm just going to tell you again, I have the symptoms of deficiency and the supplemental suggestion, so the form of the vitamin, the best form of the vitamin that you want to get it in. So I'll let me see which ones we can touch on. As you can see, they have a lot of the same deficiency symptoms. Riboflavin, which is B2, a lot of times you'll see what we call chelosis, where you get those little sores on the side of your mouth. A lot of people get. That's a riboflavin deficiency, so that's a sign that you're not getting enough in. Also glossitis, where your tongue might swell or get real smooth and sometimes painful. That's a sign of B2 deficiency, as well as some other B deficiencies. And sensitivity to light as well. B3 is niacin. The major disorder is called pellagra, where you get the 4 Ds is what they call it: diarrhea, dementia, dermatitis, which is skin problems, and then ultimately death if you get very deficient. You'll see a lot of these B vitamin deficiencies, especially in alcoholics or people that aren't eating. Okay, it's very, very common. So these are the different forms of B3 that can be taken. And also, B3 can also be taken for cholesterol. I'm sure you've heard of niacin and cholesterol. The only one you don't want to take for cholesterol is this one. It doesn't help. Inositol hexanate. So if you see that one, you're taking it for cholesterol, don't take that one. But also, tryptophan, that also remember how I talked about tryptophan making serotonin and melatonin? It also can be used to make niacin, but you have to have these vitamins. Okay, so if you're deficient in one, you kind of start becoming deficient in a lot of them, okay? So that's about niacin. Pantothenic acid, pan means all over the body. So pantothenic acid is really one that's used everywhere. It's especially a part of DNA production or cell replication. So it's heavily concentrated in the adrenal glands as well. So if you're having adrenal fatigue or chronic fatigue syndromes or low blood pressure, you want to make sure you're getting enough B5 in. So if you're getting real dizzy when you stand, things like that, that's a sign of deficiency. Pyridoxine is B6. All right, these are some more deficiency symptoms, especially you'll see acne and dermatitis with B6 deficiencies. Again, B12, cobalamin. One of the number one signs is the stocking and glove neuropathies, where you have numbness and tingling in the stocking and glove areas, so your hands and feet. This is especially deficient in people with gastrointestinal problems. Okay, if you have GI problems, or a lot of elderly people become deficient in B12. There's different forms of it: methyl adenosocobalamin, hydroxycobalamin, cyanocobalamin. The best form really is methyl, although it's very expensive. Then you have hydroxy. Cyanocobalamin is the one you see most often. It's not the best one to take because it does let off a cyanide radical in the body, which is not, you really want to get methyl if you can. Also, so cyanide, actually B12 is used sometimes IV or hydroxycobalamin is used IV for cyanide poisoning, okay, because it picks up the cyanide. So that's just a little note for you there. Folic acid, you hear about folic acid in pregnancy, right? It causes neurotube defects. Also, one point I want to make, because a lot of women are on birth control pills and estrogen, highly depletes folic acid, and you really need to be on way more than even a prenatal has to build back folic acid levels if you've been on those medications or you're taking those. So I always make sure people are on high-dose folic acid. And a lot of people that have been on birth control pills will have a lot of cervical dysplasia or abnormal pap smears, things like that, and it could be due to folic acid deficiency, okay? Just so you know that. All right, so when to consider IV therapy. So these are, I'm going to talk about now about the times when you really, really want to consider IV therapy, at least in the beginning for a few months to get your nutrient levels up, especially if you tested them here and you're deficient, okay? So malabsorption. All right, remember how you learned about absorption earlier? Malabsorption means you're not absorbing things properly. So things like celiac disease. You remember those little microvilli I showed you? Celiac, those microvilli become very blunted and absorption doesn't take place. And so you might not even have GI symptoms and have celiac, but you're not absorbing nutrients and you'll have crazy symptoms all over your body and no one knows what's going on, and hopefully one day they figure out you have celiac disease. Inflammatory bowel disease, which is your Crohn's and your ulcerative colitis, sometimes IBS. It's not really inflammatory, but a lot of people with IBS or irritable bowel syndrome actually have a lot of inflammation in their GI tract. Also, lack of bile secretion. If you don't have your gallbladder, you can have digestive problems, so that's another malabsorption issue, okay? Another problem is insufficient intake, all right? So many kids and so many, not even kids, women, I'm gonna say women, but also men, eating disorders, anorexia, bulimia, things like that. If you've spent years going through those disorders, you're probably very deficient in certain nutrients. Restricted intake, dieting, you know, going on these diets that are processed shakes and foods and puddings and things like that, you'll start having vitamin deficiencies. Also, people that live alone, a lot of elderly will live off like toast and jam because they don't want to cook and it's just easy. And if you spend weeks and months doing that, you're really going to they really become deficient in vitamins. You remember how I talked about B3 deficiency in pellagra? You'll start seeing dementia, dermatitis, diarrhea in elderly people because they become so deficient in those vitamins. Children addicted to kid foods, all right? So Kraft mac and cheese, chicken nuggets, you know, everything that's on the kids' menu at restaurants. Those children might become vitamin deficient. So if you have kids, order from the adult menu. Teach them to eat real food first, okay? Prepackaged food, fast foods. So a metabolic impediment, okay, so what that means is a metabolic problem. Like, for instance, if you have a problem making vitamin A in your GI tract, remember I told you that? If you can't, vitamin A in the cells line in your GI tract are made from beta carotene, and there's a whole process. So some people have a problem with that, and so they can become vitamin A deficient. It's hard to tell. That's why seeking professional help is a good thing. You know, we can help you figure out what's going on. Excessive intake of certain nutrients. So a lot of people, you know, especially people who are overweight or obese, they say, I can't be deficient in anything. Well, a lot of times you're getting a lot of carbohydrates, a lot of protein, and a lot of fat, but not the micronutrients because you're eating a lot of processed food, and you become, even though you keep eating, you become tireder and tireder because your metabolism is not functioning because you're not getting the micronutrients. So if you don't get the micronutrients, all of those carbs and protein and fat only can be stored as fat in the fat cells. So you start getting that big belly. All right, that's why nutrient therapy is very helpful for weight loss and getting your metabolism up, okay? And also, if you eat a lot of carbohydrates, which most people do, because I think people think they need more carbs, and for some reason they think the only way you can get them is through grain products, which is not true. You really deplete B1. You'll see thiamine deficiency because thiamine is really, really needed for carbohydrate metabolism. So you'll see that in people that overeat carbohydrates, people that don't eat fat, things like that. All right, so if you're on these medications, these are some of the common meds that I typed up here. Anti-inflammatory, we talked about some of that over here. Anti-inflammatories, birth control pills, antidepressants, cholesterol meds, antibiotics, antacids. So those are your proton pump inhibitors, your Nexium, Prilosec, all of those. And diuretics. And I wrote the nutrients that they deplete, so you can see that. So especially if you've been on them for quite some time, you're going to start having, that's where the side effects really come in, okay? With the cholesterol meds, you start depleting certain vitamins, antidepressants, okay? Folic acid is a big one for birth control pills, and you get cervical dysplasia, okay? All right, and we talked about diuretics and magnesium, but diuretics also deplete calcium, potassium, and all your B vitamins because they're water soluble. So if you're an athlete or if you're sweating a lot, you definitely need to be worried about vitamin deficiencies, especially if you're an athlete and you eat the SAD diet, the standard American diet. Okay, so if you're exercising, which is great because you're breaking up muscle to rebuild it, but if you're rebuilding it with not good stuff, that's not very good, and eventually you're going to have chronic problems, tendinitis, pull a muscle, osteoporosis. People are like, I'm exercising, but I have osteoporosis and I'm eating right. Well, they're not getting all the nutrients in, okay? And sometimes too much of something, people are on so much calcium, things like that, actually can be worse and cause osteoporosis. So you want to be careful. Because I see people taking way too much calcium.
Oh, is that a dog?
Yeah, I mean, people taking 1,200 milligrams and then they're getting 1,500 milligrams in all their dairy products that they're eating, and they still have osteoporosis. So there's other causes of that. All right, environmental toxicities. So the more toxic you are, the more your liver has to detox. Okay, you're going to need a lot more of these things. So like I gave the example of the woodworker. A lot of woodworkers, believe it or not, are exposed to formaldehyde, all the fungicides on the wood to preserve it. If you're working a clothing store, very toxic place to work because all those clothes are coated in formaldehyde. That's why you want to wash your clothes when you buy them. You don't want it to touch your dry cleaners, things like that. There's toxicities all over the place you don't even know about. Okay?
What, isn't it good for you to sweat?
It is. You're getting rid of
toxins.
toxicities, right? But you need to make sure you're getting good nutrients in. It's not good to sweat if you're eating this way. I mean, if you're eating the standard American diet, a lot of sugar, a lot of carbohydrates, and you're sweating, it's not a good thing. You want to make sure you're eating well. That's why addressing diet and lifestyle and stress and all of those things is extremely important. So you'll have to do everything. Okay. That's why modern life is not our way. That's why IV therapy is beneficial, because our way of lives have changed. Done it, like I said, 180 in the last 100 years. Our bodies haven't adapted. All right, liver diseases. If you have a liver disease, fatty liver, any problem with your liver, you're going to be depleted of all of these vitamins. Bariatric surgery, if you had weight loss surgery, definitely deficient in vitamins.
What's
okay? Weight loss surgery, stomach stapling,
Oh.
gastric bypass, things like that.
Oh, wow.
Increased tissue requirements, growth, pregnancy, stress. If I haven't said it enough, stress. I hate the word because no one really understands what it is. It's just overstimulation to your senses, basically. So not just, bad stress. Even good stress can be bad over time. All right, and there's some more slides here. I know we're running out of time, but I'll run through it real quick. Why we can't solely depend on our diets. Our foods are overcooked and canned. If you're a college student and you're relying on the cafeteria, food just sits there for kind of hours, and as it sits there, it loses all its nutrients. Canned foods don't really have any nutrients in them. People dislike foods that have all the nutrients in them because they're so used to that sugar and salt stimulation on their tongue. Their taste buds are kind of crazy. Commercial processing of foods. I mean, the reason they fortified foods is because they know how important those nutrients are, and that they know people aren't getting them in with the American diet. That's why companies are fortifying. So don't eat fortified foods. Eat fresh, frozen, real food. Okay. So most people don't buy produce because they think that it's expensive, yet these same people will go to the vending machine and spend 80 cents on a bag of chips, but an apple will cost about 75, 80 cents. I mean, it's just relative. Why we can't depend on our diets, we're not eating local, we're not eating in-season fruits. I think there's something to eating local and what's in season for that population in that area, but we don't do that, okay? Because we ripen our tomatoes year-round with ethylene gas, and now we have tomatoes year-round. So, Let's see. Fortified nutrients are also some of the worst forms of the vitamins. Remember how I talked about the bad forms? And they're not really absorbed in a lot of people. So don't rely on total for your vitamins. Okay? All right, so the best thing, the take home is prevention. All right? If you can have your nutrients tested, that's the best thing to do, and get them normal before damage happens to your body. That's the best time. But if you already start having symptoms and damage, that's where IV therapy can be really effective and efficient to get you better more quickly, so that if you have GI problems, your tissues can't heal through oral tissue. You're not even getting the nutrients in for that tissue to heal. That's where IV therapy can be very beneficial.
Do you know a good place where a person could get those tests done?
Well, they can get it done at the Reardon Clinic here in Wichita, Kansas, 3100 Hillside Drive. Ask for Dr. Kallmeyer. No, I'm kidding. All right. So just to recap, this is what we talked about today, if you already didn't know. The major take-home is this, and I'll probably say it in every talk I do. Stress, diet, not just diuretics, but stress and diets, lifestyle, exercise is important. Even changing your thoughts, things like that, can help your physical body heal, because everyone's anxious all the time and causes damage. So vitamins, we talked about vitamins and minerals, intravenous therapies, common nutrient deficiencies, symptoms of diseases, prevention. Okay? Any questions?
Thank you,
Okay.
Dr.
Yeah,
Kallmeyer.
you're welcome. Thank you. It was fun.